Hi, my name's Phil. I like to talk about politics, and in this video, I'd like to discuss Boris Johnson's press conference on Saturday related to the concerns over the Omicron COVID variant, how he's using the new potential crisis to cover for his earlier failures, how the media are responding, and just for good measure, tackling a couple of the usual COVIDiot responses as well. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel and click the bell notification icon. So a couple of bits of COVID admin first, I suppose. When I talked about this on Saturday, I was talking on Friday, in reality, recorded it on Friday, and was calling it the new variant, because that would what would be next. But I was also saying how it's probably confusing in English-speaking countries, you know, even though the Greek letter nu was next in line, and they probably should have skipped over to Omicron. Well, it seems that the World Health Organization were of the same mind, because by the time the video was published, they had skipped over nu and called it Omicron. Now, some people may say, well, hang on, Philip, Xi comes between nu and Omicron. Why not Xi? Well, the reason for that, for some people, it'll be fairly obvious. Although I suppose it's a different pronunciation, it'd be Z, wouldn't it? But nonetheless, naming a variant after the head of the Chinese government would probably be a bit of a faux pas, especially when some populist Western leaders keep trying to blame China for their own incompetence. So they've decided not to name it after a head of state. But anyway, it's not new, it's the main thing. The puns are gone. Cue all the jokes about it sounding like a Decepticon invasion. Actually, ironically, there was an Omicron in the Transformers film, wasn't there? The good film, not the ones that Michael Bay ruined. But never mind. The second point was that, predictably, all the people wanting to downplay this new variant were out in force. One centred around the South African Health Authority complaining about the reaction to put South Africa on the red list, when, in their words, this new variant produces only mild illness. Now, there are a couple of things about this. First of all, yes, these people are experts, but they're also political. I try and advise people to follow independent experts, and a good range of them in a number of countries. You know, by the nature of the jobs, though, government officials are going to have their statements filtered politically. Just as Whitty and Valence in the UK are experts, absolutely, but what they say is heavily filtered by the political wishes of our Prime Minister. You know, we only just know about this variant. I want to say we, I mean the whole world. It's only just been discovered. It was first sequenced from a sample taken from someone on November the 9th. But of course, it took a while to actually identify it. We actually have a lot to thank South Africa for sequencing it so quickly, so expertly, and sharing their information so readily. If all other countries were as open about this, then we'd be in a lot better place. But the idea that someone, even an expert, can say for certain what properties this variant has when we've known about it for less than a week is ridiculous. There is evidence that it is more transmissible, but we don't know. We need more data. There is evidence that it might be able to evade vaccines more easily than Delta, that is, our currently dominant one. But again, we need more data there as well to be certain. Note that evade more easily doesn't mean completely immune, so what's the point in vaccines? Just that the protection of the vaccines, which isn't 100% for any form, may be less against Omicron than Delta. Vaccines are still a lot better protection than no vaccine at all. But the severity of the illness is something we have no clue about. But this is where most people's logic may even fall, even when we do. Like, most people would naturally think that if this variant produces less severe symptoms or is less deadly, then that's actually better. No, it could be worse. That could actually lead to it killing more people. A less deadly virus can kill more people. Sounds weird. The reason is, like, if you compare coronavirus with, say, Ebola, Ebola's a rubbish virus by comparison because it's so deadly. It scares people more. But it produces symptoms very quickly, kills its host very effectively, so it's easy to contain. Ebola is very bad news for people caught in the outbreak, but it doesn't spread around the world. Coronavirus keeps its host alive most of the time, and when it does kill, it kills slowly. That allows it to spread far and wide in unsuspecting and unsuspected hosts. It allows it to spread to people who are more vulnerable before you even know it's about. One infectious person could infect hundreds of people before you even know that they're infectious. if it does produce milder symptoms, that will only allow people to be infected in a way that makes them think that what they've got, any small symptoms they have, are not worth testing because it's something else. Therefore, more likely to remain unaware that they're even infectious and pass it on to people who are less protected. This is a particular problem in populations with low vaccination rates, and all just in time for winter in the Northern Hemisphere. You know, people are saying, don't sweat it. You know, they've already said they can tweak the vaccine. Yes, I saw a report that said that one producer could tweak it in about 100 days if necessary, you know, but think about what that means. 100 days, several months. It means we have to get through almost all of winter before that tweaked vaccine is ready. And then bear in mind, we're all going to be vaccinated the next day. We have been vaccinating people for nearly a year in the UK, and we've still only got just over 2/3 of our population vaccinated. Just over 2/3 after nearly 11 months, basically. Tweaking the vaccine doesn't solve the problem overnight, and has, you know, often been said by independent experts as well. Vaccination's a powerful tool against this, absolutely essential, but it can't do the heavy lifting on its own. But it sounds like the government's advisor sat Boris Johnson down and told him very clearly what the situation was, because on Saturday he held a press conference. This, although what I'm going to go through, what he's set down isn't enough, it's still a lot quicker than he's acted in the past. People have pointed this out. You know, be thankful for small mercies. He's never acted this quickly before. He held a press conference to announce that more measures would be coming in. Not until Tuesday. He's given several days first. Why not? But it includes wearing face masks in, as far as we can tell, most indoor settings. At the time of, you know, me discussing this, it's still up in the air exactly where that is. There are some we know about, there are some we're not sure about. Unfortunately, I didn't hear or see an announcement about schools. I don't know what's going on there. If the mask mandate doesn't apply in schools, the impact will be limited. At one point in the press conference, Johnson appeared to say that we would step up our vaccine programme. Now, you'd think, okay, you know, vaccinate people more quickly. Okay, does that mean we weren't doing that before? Weren't we already rolling out the vaccines as quickly as we could? If so, how can we do it better? If not, why not? Also at this point, my usual note that this is for England, bear in mind, the rest of the UK do their own thing and have been treating the virus more seriously than England throughout. You know, everyone else is less insane than Boris Johnson. I'm not saying they've all treated it seriously enough or they've all done enough, but it's been less of a shit show than this part of our little plague island. Johnson was also vague in the press conference, even about the rules on masks, even though it's clear they're coming back now. He didn't really want to say. He had to be pinned down by journalists to give anything like a clear answer. I saw someone making an interesting comment, and it makes sense. It doesn't mean to say this is the thinking behind it, but it does make sense. He says that if Boris Johnson had given a clear instruction on face masks and people did not comply, then Boris Johnson has lost the faith of the public. However, if he gives a vague instruction and people do not comply, then it can be claimed that they misinterpreted his words, that they wanted to do what the Prime Minister was advising, but they didn't quite understand. But then there is also the explanation that he's a libertarian and he doesn't actually want this in. So it's almost like he's been forced to say it, like a child who has to say sorry to get their PlayStation back, but they're not really sorry. You know, the words choking out of them. Fortunately, we're not completely reliant on his words because the government website will have that information. But as I say, whatever it is not going to apply until Tuesday. Masks are back in effect. I mean, we know that they're going to be back on public transport and in a number of other settings. I mean, one of the most tragic aspects of the changes in the rules for me is that I look at them and I go, I don't have to change a thing. There's nothing in the new rules that I wasn't doing already. But there was something else. Since so-called Freedom Day, when almost all mitigations were removed in England, we've had nearly 20,000 people die in the UK from COVID. Brilliant. But ever since then, the government have talked about a plan A and a plan B. We have this plan A, which is basically do nothing. Then we've got this plan B, which is to do something. So you may imagine, oh, so we've moved to plan B now, have we? No, we haven't. Which again shows the nonsense of the government's planning. You know, there was, for months they've been going, we're in plan A now. If we need to, we'll move to plan B. So it's like, okay, so we're now, the government are now saying, okay, we accept that plan A isn't enough. Oh, so does that mean we're going to go to plan B? No. In which case, what is the point in plan B? What is the point? What we're doing now, it's more than plan A, it's less than plan B. It's like plan A plus. But there was no plan A plus. Therefore, the government's planning is a complete joke yet again. People need to point this out. Now, a journalist asked a question of a SAGE advisor, not at the press conference, of a SAGE advisor, someone from the Financial Times. And the SAGE is the government scientific advice group. And the response was, and I quote, "If what we think we know now turns out to be approximately true, then Plan B won't be anywhere near stringent enough to stop this." Now, let's break that down. First, like I said before, we don't know enough about this variant. So they're just sort of summarising what they can from the limited data they have. This is why our measures should be hard now and pull back if it's not that bad. They can't be reactionary. But the problem is they are. Waiting to see, exactly what the situation is means that by the time we find out if it really is that bad, it's too late. Too late. But if it is approximately as bad, they said, approximately as bad as feared, not as bad as feared, just close to it. It could be not as bad as feared, but still not far off. Then Plan B won't nearly be enough. Not just that Plan B won't be enough, won't be nearly enough. We're not even adopting Plan B now. What we have is less than that. Some other comments from the grown-ups to consider. Professor Pagel, one of the independent experts I pay close attention to, noted that nobody at the press conference even talks about long COVID. Not the chief medical officer, not the chief scientific advisor, not the Prime Minister. It seems clear to me that they're not even including it in their thinking. They're certainly not wanting to talk about it. It's purely about managing the politics of the situation. That's what the distressing situation is. Long COVID, that's for a future government to worry about. Even though it's depriving us of essential workers right now, especially in the NHS and schools, right now. All the government care about is what the death rate is that they can get away with and still get people thinking they're doing their best and, more importantly, doing better than anyone else would. It's also been mentioned that this variant need not have occurred if richer countries had helped vaccinate the poorer ones. Boris Johnson claimed that the UK had done a huge amount to vaccinate the world, but as a Birmingham MP pointed out, absolute nonsense. Boris Johnson has blocked international agreements to produce more vaccines. What we needed to do was to say, never mind your licensing. Any lab around the world that can produce this vaccine, let them produce it. We'll worry about, compensation later on if necessary. Let them produce it. We could have vaccinated the world. No, they haven't done that. And Boris Johnson was one of the voices calling for that not to happen. There have been others, but here's one of them. We have retained stocks of vaccines. We're about to destroy a right load of vaccines because they've passed their expiry date. We could have distributed them elsewhere. We didn't. We've destroyed them rather than let poorer countries have them. And we have cut funding for COVID research programmes. We were fine. We actually did quite well last year when we wanted the vaccine. As soon as we had the vaccine, that was it. We cut the research programmes. That's all we wanted. And that is to say nothing of the way that Boris Johnson arranged vaccine contracts to effectively prevent the export of vaccines from the UK early on. So we were importing vaccines from the EU and other countries. We weren't exporting them anywhere else. We were hoarding them. That's why we stole a march on others. The bottom line is that Boris Johnson's government, in the face of this global catastrophe, is basically on the side of the virus. I half expect the coronavirus to be given a seat in the House of Lords soon. And for someone later on to discover that it's been paying Boris Johnson's, fund for gold bog paper or something. Thanks to him, at a time when the UK could have been a positive force for good, we have become a barrier to progress, an active hindrance. I've said before, I think European powers in general have been poor. This isn't singling out the UK. European countries have been poor. But we couldn't do anything about other governments because, they're sovereign and all that. And especially outside the EU, we can't even influence collective EU thinking anymore. But we could have led by example ourselves. We didn't. And now we're just hoping that this Omicron variant isn't as bad as feared. But even if it isn't, now that it's in the UK, and we've now discovered one that didn't come directly from South Africa, so we know it's spreading, what's to stop us producing a newer variant that is the antichrist of viruses ourselves? Still nothing, is there? We were already not coping with Delta. One of the buggers of this Omicron variant is it's allowing the government to pretend that everything would have been fine this winter and Christmas. It wouldn't have been. It would have been a mess. Without a new variant, it would have been a mess. Both Delta and Brexit were creating a firestorm. Healthcare workers are knackered. Our supply chains are knackered. But the healthcare workers, imagine the load they're going to be under this winter. Many are suffering from long COVID. The rest are overworked, undervalued, and now, on top of everything else, on top of not having the resources to cope with even a normal winter, don't just have a COVID winter, but a COVID winter with a new variant that at the moment we don't know enough about. They'll get no support from the government other than empty thanks, maybe a clap. Johnson probably doesn't like having to bring in the new measures, but I'm sure he's loving the fact he can now blame another buggered Christmas on foreigners. But those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, please also click the Patreon link for details. And until next time, I'll see you later.